The world wanted to know, why is it that some people live longer than others? And especially, why is it that some people crack that 100-year barrier? And they did research and studied the world and found 1, 2, 3, 4, 5 areas in which people lived longer than 100 years. Well, these areas they called the blue zone. Not because it's blue, it's just because the researcher at the time used a blue pen to actually draw around those areas, and so it was called that. The areas that were found around the world where people lived greater than 100 years in small pockets were Costa Rica in Nicosia, Italy, Sardinia, Greece in Arcaria, Japan in Okinawa, and in the United States of America, a small area called Loma Linda. What is it about these groups of people that seem to give them the edge that they can live more than 100 years? This is not 1 or 2 people in the community. This is a group of people living in specific communities with specific health habits. And we want to look in detail, we want to zero in onto these habits, these practices of health that seem to help to change the way disease affects their body and how long they live. And so one group of people specifically have been looked at. All of them have been looked at. But extensively, a group of people have been looked at specifically in California. That group in Loma Linda, the Seventh-day Adventists. And you can see that National Geographic got very excited about the fact that they had a group in the USA, in a developed country, in which they could find centenarians that lived over 100 healthy lives, some even doing surgery, physicians doing open heart surgery at the age of 98, and some people exercising, lifting weights and walking at the age of 102, 103. People using bicycles on the main road, people using cars by themselves over the age of 90. And what did they find? Well, they found that the Loma Linda group, who were mostly Seventh-day Adventists, these are the characteristics that they found which were very interesting and very specific to this group. The majority drank plenty of water, 5 to 6 cups a day. And they had more plant-based diets. Mostly were vegetarian, if any, very small amounts of meat. Some ate fish and some had a mixture, but the majority were vegetarians. They ate an earlier, lighter dinner. They also volunteered working in that group. They also had an interesting habit of eating nuts at least 5 times per week. It was actually quantified as a small handful of nuts, varied types of nuts. They got regular exercise, moderate exercise, daily walks, and they maintained a healthy BMI. Also, interestingly, they had a weekly break from the rigors of life. They had a 24-hour Sabbath period in which they focused on family, on God, camaraderie, and nature. They also claimed that these habits of having nature walks and camaraderie and focusing on the family apparently relieved stress and strengthened their social networks and provided some consistent exercise. They also spent time with like-minded people. Adventists tended to spend time with lots of other Adventists who shared in the same values and support systems and habits that they had. And so one of the studies, early studies done from 1974 to 1998 are of interest to us because it looked at detailed. Actually, the US government wanted to know what was it about this group of people that we could distill information to find out how we would probably look at modifying lifestyle so that we can put this in a general populace. So at that time, the first Adventist health study was done with 34,000 California Adventists, age 25 and above. And they investigated these factors to see how they would compare to the general community, specifically in health, habits, and diet and lifestyle. Well, the key results were very interesting. They found that vegetarians had a lower risk of obesity, hypertension, and diabetes, and death from all causes. In men, the risk of fatal heart disease was significantly related to beef intake. Significantly related to beef intake. Regular nut and whole grain consumption were associated with lower risk of coronary heart disease. The risk of colon cancer was increased by 88% in non-vegetarians compared to vegetarian Adventists. Consumption of legumes, such as beans, had a protective effect against colon cancer. Another interesting finding, on average, Adventist men lived 7.3 years longer, and Adventist women lived 4.4 years longer than other Californians in their community. And men with a higher consumption of tomatoes, interestingly, had a 40% lower risk of prostate cancer.